so I can protect him.
The person I'm protecting is my lovely mother, Vivian, who is 93 years of age and living on her own. And I'm more than happy to assist her through the lockdown.
This is my daddy, who is diabetic, and I care for him. Say hi. Say hi.
Who's that?
Just say hi.
Hi.
Good evening, Bermuda. We remain humbled to serve as your government and are grateful to everyone who has reached out with your words of encouragement and to everyone who continues to keep us and the country in your prayers. The days may be long, the work hard, and sometimes discouraging, but through our faith and with your support, we know that we will make it through these days of uncertainty. Over the weekend, through the combined efforts of the Ministries of Health, National Security, and Public Works, together with Dr. Karika Weldon, Bermuda's testing capacity has been expanded. This massive game changer in the war on COVID-19 provides us with the means to better protect the health and safety of our community. I would like to thank all of the persons who were involved in that exercise to get Bermuda's second lab up and running. 209 persons were tested yesterday at 6 different quarantine facilities, and that in and of itself is an incredible feat. I would also like to take this opportunity to thank Dr. Desiree Spriggs of the Helix Laboratory, who has worked around the clock for the last 4 weeks providing Bermuda on-island testing capability. I am sure that Dr. Spriggs will be relieved that Bermuda now has testing redundancy and she might be able to relax a little bit. Today, the Minister of Health will provide an update on the cases of COVID-19 on the island, our expanded testing capacity, and the continued work being done on behalf of all Bermudians in battling this virus. Minister of Health.
Good afternoon. Today there were 42 test results received, and I'm pleased to report that none of those 42 test results were positive. Following the weekend's results, Bermuda's total confirmed positive cases stands at 86. Their status is as follows. There are 44 active cases, of which 33 persons are under active public health monitoring and 11 persons are hospitalized. A total of 37 persons have now fully recovered, and the average age of all of our confirmed positive cases is 55. The median age is 85, and the age range of all of our positive cases is from 18 years to 91 years. The age of persons hospitalized ranges between 57 and 87 years, and the average age is 72. Of the 86 positive cases confirmed to date, 37 are males and 49 are females. As the Premier stated in his press release yesterday and just a few moments ago, now that our second lab has come online, we have significantly increased the number of people who can be tested in Bermuda for COVID-19. The next step is to focus on testing healthcare professionals, our vulnerable in seniors' homes, contacts of persons who have tested positive for COVID-19, and our essential workers. Everyone who is currently in a government quarantine facility has now been tested for COVID-19 ahead of them returning to their respective homes. Throughout the day yesterday, over 200 samples were taken from individuals at the 6 government quarantine facilities. Preliminary results have been received, and those persons who test status by a public health officer or their physician. Persons who tested negative will be able to leave the quarantine facility starting from 2:00 p.m. tomorrow until the completion of their 14 days quarantine. They will also remain under public health supervision and self-quarantine at home for a further 14 days. Persons who test positive will be required to quarantine at the government quarantine facility for an additional 14 days and will remain under active public health monitoring, including daily temperature checks and phone contact by public health officers. Those who cannot adequately self-quarantine at home, in other words, those persons that are not tested positive and for whatever reason cannot adequately self-quarantine at home, will be able to continue their next 14 days quarantine at the government quarantine facility. Yesterday, the Ministry of Health issued a press release regarding a very concerning story posted online by one of our media outlets yesterday afternoon. And I felt it crucial that the ministry respond quickly to dispel misinformation. And I want to reiterate the information now. As reported by the Ministry of Health last weekend, COVID-19 was confirmed at the Matilda Smith Williams residence home. This involves 2 residents and 2 staff members. Unfortunately, these results confirm spread of the virus within the facility. As a result, all residents and staff underwent testing for COVID-19, and 23 positive results were confirmed in persons associated with the outbreak at the care home. There was concern that residents at the home may not have been receiving appropriate care, and I want to clear that up now. The Ministry of Health liaised with the facility's interim administrator as soon as the outbreak occurred to ensure that medical care was provided to the residents. All residents who require medical assessments have had them performed by medical professionals, and no medication has been given to residents by unqualified personnel. A registered nurse has been attending the facility every night since early last week, while the Department of Health has also provided a registered nurse who has also been attending daily. On Saturday, a medical director was appointed to the facility by the Ministry of Health to provide on-site and off-site medical guidance and intervention in the response to COVID-19 outbreaks at the facility. Additionally, the Department of Health will provide home resource aids to the facility. And as of yesterday, a full-time nurse has been appointed to the home. The Ministry of Health has provided PPE to the facility, including gowns, masks, gloves, face shields, goggles, hand sanitizer, disinfecting wipes, and trash bags. Additionally, the Department of Health's community health nursing staff provided PPE training on Friday morning at the home for all staff regarding the correct use of PPE and proper infection control. The Epidemiology and Surveillance Unit is currently managing the outbreak in the facility and have recommended that additional measures be put in place, and has provided further guidance to the staff in monitoring of their health status, infection control measures, maintaining social distancing, isolation, and monitoring of the health status of affected residents. In conclusion, I want to reassure the public that we are working closely with Bermuda's 21 care homes as we understand fully the vulnerability of these populations. We have been working with these homes for several months now and will continue close collaboration to ensure any concerns are addressed immediately by their respective boards and management, and that their operations can remain stable. Thank you, Premier.
Thank you, Minister Wilson. With economists predicting that we face a global economic crisis unseen since the Great Depression almost a century ago, we recognize that when we emerge from shelter in place together, we will have to fight to work to build a Bermuda that works for everyone. Behind the scenes, in a massive community effort, we are listening to stakeholders, consulting with the general public through the Citizens Forum located at forum.gov.bm, and we are designing the economic policies and stimulus needed to rebuild our economy. The unemployment benefit is a safety net we created based on our belief that we have an obligation to support those who, no fault of their own, are unable to work. The Ministry of Labor, Community Affairs, and Sport and the Department of Workforce Development are to be credited for getting this program up and running in quick order and are tirelessly working to get the payments out to applicants who have been economically displaced by this pandemic. As a government, we believe that we must listen, we must be flexible, and where appropriate, we must act swiftly to adjust and innovate so that we can make sure that Bermuda's families are protected. Minister Fogo will now give an update on the unemployment benefit. Minister?
Thank you, Premier. First and foremost, I want to extend my appreciation to those who have submitted applications for the unemployment benefit. We recognize that these are very anxious times for you, and we are working around the clock to make sure that you are provided the financial relief. In that regard, we thank you for your patience. The Department of Workforce Development has been flooded with unemployment benefit applications since we began accepting them on March 25th, 2020. Since this time, we have been receiving applications both in hard copy and electronically. The hard copy applications are being keyed in by staff. $7.7 million have been paid since the launch of the fund. The Department of Workforce Development has received 9,108 applications. Of that number, more than 5,000 have received benefits. 3,718 were paid on April the 2nd, and individuals received 2 weeks of unemployment benefit. They were paid again on April 17th and will continue to receive their benefit as long as they remain eligible for the 12 weeks of benefit. Some persons will not have received notification of the payment and should review their bank records to see if payment has been received. An additional 1,290 applicants received their first payment on April 17th and should have received notification of the payment. 4,100 people have submitted an application and are waiting for payment. The benefit application is a two-part process. Employees must complete their application and employers must verify the information. Employers, if you have employees who have completed their application but not received their unemployment benefit payments, you would have received an email. You must complete the form and submit it electronically. This is the only way your employee will receive payments. For the applicant, you should look for an email that confirms your employer has validated your application. If you have not received an email, contact your employer and ask them to verify application. Payments are made every second Friday. All verified applications that were completed by April the 8th were paid on April the 17th. We will look to make more payments this week. If both parts of an application have been completed and payment has not been made, the applicant should double check their banking details. Many payments have been rejected due to incorrect or incomplete banking details, or the applicant did not provide correct supporting details or appropriate documentation. Some applicants have provided their salary details incorrectly and as a result have received payments different than what they expected. There are 300 applicants who do not have a bank account and are therefore unable to receive electronic payments. The Department of Workforce Development is working to get checks to these individuals. Contacting the unemployment benefits sections in order to answer the large volume of calls received, we have put in place another 12 numbers which will currently be posted. But for now, the current numbers which have slightly changed are 707-5438, 707-5439, 707-5440, 707-5442, 707-5443, 707-5445. The unemployment benefit form can be found at www.gov.bm. Emails can also be sent to unemploymentbenefit@gov.bm for any assistance needed. To check on your payment status, applicants should use the link they were sent when they submitted their application and can see the status of their application. For more information, visit bermudajobboard.bm/UBA. Thank you.
Thank you, Minister Fogo. And I have heard the stories of persons who may be waiting to get the unemployment benefit. If you are hungry, please do not suffer in silence. And if you are someone who does not qualify for that benefit and you are having difficulty during this time, please do not suffer in silence. Reach out to the hotline 444-2498. There are many organizations who have stepped up to help the less fortunate, and the last thing we want in Bermuda is for persons to be at home and are hungry. There is assistance that is available outside of this unemployment benefit, and we want to ensure that persons who are at home, who may not have access to food or essentials, can get that access to food or essentials. It is there. Please do not suffer at home in silence. Next, it will be Minister of National Security, Minister Keynes, with an update on items from the COVID-19 EMO and his ministry. Minister.
Thank you, Premier. Premier, most recently, we've had people reaching out to the ministry wanting to know how can they notify us of people breaching the shelter-in-place regulations, i.e. someone being out after curfew, a neighbor being out late when they do not have an exemption, a late-night party with more than 10 people, or people swimming on the beach. If anyone wishes to report any of those breaches, please go to portal.police.bm and click on COVID-19 violation. The portal is secure, it is quick, and it is a convenient way of reporting COVID-19 shelter-in-place violations from the comfort and privacy of your home. The Royal Bermuda Regiment, in partnership with the Bermuda Police Service, recorded the following stops at the community advisory points over the 3-day period. On Friday, 15,213 stops were made. On Saturday, there were 8,596 stops. And on Sunday, the Royal Bermuda Regiment recorded 5,031 stops. We expect that over the next 2 weeks, there will be more movement on our roads due to the increased businesses being granted approval to operate. With more residents traveling on our roads, there will be longer queues at the community checkpoints. To be clear, the Bermuda Regiment and the Bermuda Police Service will continue to be vigilant in checking vehicles at the stop points. I encourage commuters to exercise patience during this process. Have your identification on hand to avoid delays at the checkpoints. There are approximately 200 Bermuda Regiment soldiers currently mobilized. We have instituted a plan where they are housed at various locations around the island. This is an efficient protocol because it reduces time travel for our soldiers, but more importantly, it helps mitigate the risk of the COVID-19 exposure to our soldiers. I wish to extend my sincere thanks on behalf of the Ministry of National Security to the commanding officer, Major Benjamin Beasley, and the leadership of the Royal Bermuda Regiment, and of course, to the men and women of the Royal Bermuda Regiment for their service, their sacrifice in helping to keep Bermuda safe. I will offer a brief update regarding the shelter-in-place regulation for permitted businesses, which became effective today, Monday, the 20th of April. Over the weekend, the Ministry of National Security worked to ensure that the process was in place so that businesses could get the requisite approvals. Throughout the day, we have been processing online submissions received from a number of businesses seeking to operate during the shelter-in-place period. As of 5 p.m. today, 82 submissions in total, 50 have been approved, and 32 are pending approval. As a part of our process, we acknowledge receipt of the submitted application, and we advise the applicant that we will subsequently notify them whether they have been successful in receiving permission to operate. I just want to remind businesses that just because they have applied does not mean they will automatically be given permission to operate. As I indicated on Friday, any business that opens contrary to the emergency powers, shelter-in-place regulations is liable for prosecution. I appreciate that this has been a very anxious time for some businesses. I want to thank the community for their feedback, for their suggestions, for the concerns relating to services during the next shelter-in-place period. I continue to ask for the community's patience as we work through this approval process. Again, I think it's critically important to remind the community that we are following guidance from the Ministry of Health, and our ultimate aim is to protect our residents from the spread of the deadly COVID-19 virus. The stark reality is that we have a responsibility to protect the lives of our citizens. These are your loved ones, they're your family members, they're your friends, they're indeed your neighbors. The restrictions are strict, but they are put in place to save lives. Thank you, Premier.
Thank you very much, Minister. While shelter in place is necessary to protect the health and well-being of our community and stop the spread of the coronavirus, we recognize that it has created tremendous stress for many. We are ensuring that every resource we can provide is in place to assist with the economic needs of our people, and while we provide the necessary support and help for the mental health of our residents. Today, Dr. Allison Daniels, President of the Bermuda Psychology Association, will provide some tips on what you can use during this next shelter-in-place period to take care of you and your family's mental health and well-being. Dr. Daniels?
Thank you, Premier. Thanks. There's no manual or playbook that can tell us what is going to happen during this COVID-19 pandemic. We are all dealing with something that we've never experienced before. As the cases worldwide increase and the vaccine is many months away, you may find yourself feeling anxious, scared, angry, not wanting to leave the house, or finding it difficult to relax. These are all understandable reactions to a stressful event. It is important to note that we all react differently to stressful situations, and it can present itself in many different ways. As we now continue to be at home, some of us without our typical coping strategies, you may see changes in your eating and sleeping patterns, find yourself being more irritable, sensitive to, or being critical of those around you. You may find yourself worrying more about the health of your loved ones. You may see a worsening of your chronic disease or mental health conditions. You could also find it difficult to concentrate, experience fatigue, body or stomach pains, just to name a few. Here are a few steps to help you look after your physical and emotional well-being. Try focusing on the things that are in your control. Although most of us are not going to work, getting up and getting out of our pajamas mentally prepares us for the day ahead. Scheduling the things that you would like to achieve can give a sense of purpose to your day. Maintain a healthy lifestyle. Try to get at least 7 hours of sleep a night, eat a balanced diet, do some form of exercise, getting outside in the sun if at all possible. If not, doing activities inside your home. Reduce your caffeine intake and try to avoid using alcohol, tobacco, or other drugs to cope with stress. Stay connected with friends and family. Social support can help you get through stressful times. Although we are socially distancing, we can find innovative ways to connect with those we love through video calling apps. Connections can also be maintained through email or telephone calls. This is a time to share your concerns and worries with those you love, or why not try focusing on what you are grateful and thankful for? Talk about other things than the virus. Hearing and reading about the pandemic repeatedly, including on social media, can be upsetting. Try taking a break and ensure that you are getting your news from reputable local sources like www.gov.bm or the Premier's press conferences. You can go to the Center for Disease Control and Prevention or the World Health Organization. There is so much fake news out there which can lead to unnecessary worry and anxiety, so do your best to limit your exposure. Here are some tips for parents to support your children. Children may have a different response to COVID than us. Be vigilant to any changes in your child's behavior. They may become more clingy, anxious, withdrawn, angry, complaining of butterflies in their stomachs, or returning to bedwetting. Give them the opportunity to talk about their feelings. It is important to be responsive. Listen to what your child is concerned about and reassure them. Talking about this pandemic in age-appropriate language that is developmentally appropriate and provide them with extra love and attention during these trying times. Maintain order in their lives as much as possible. All children find routines reassuring, and this will help when it is time to transition back to a normal schedule. It is important to establish time for education and just as important to schedule time for fun and relaxation. Stay connected with friends and family. Children are also missing their loved ones. Try to build in time for virtual interactions to help them stay connected. This can also provide reassurance that their loved ones are okay. Again, limit their exposure to the news. Constantly hearing and reading about COVID can also have a negative impact on your child. Do your best to monitor their exposure, and if you can, limit your time to reading and seeing about COVID when you're with them. This will give you an opportunity to explain what they are hearing about, and you can answer any questions that they may have. Throughout this pandemic, acknowledge your feelings. Whatever you're feeling right now is okay. But if you feel concerned that the stress and anxiety of this pandemic is having an impact on your daily life, reach out for support for yourself or your children. There are several helplines set up to assist. The Emotional Wellbeing Hotline, which is available 7 days of the week from 9 a.m. to 9 p.m., and the number is 543-1111, or Child and Adolescent Services COVID-19 Crisis Line, which is available Monday to Friday, 9 a.m. to 5 p.m., and their number is 249-3370. Both these lines are staffed by qualified caring professionals by providing assistance or a listening ear. Reaching out for support shows strength, and coping with stress will help to keep you safe and happy. Stay safe, stay home, mask up. Thank you, Premier.
Thank you very much, Dr. Daniels. Before we go to questions, I would like to again thank everyone in our community who are doing their part to protect the health and safety of our island home. You are appreciated, and we are truly grateful for the work and sacrifice that you are making for all of us. This morning, I received a message from a patient in the hospital, and she wanted me to know that she is receiving exceptional service and support from the doctors, nurses, and staff at the hospital, and wanted to extend her thanks and appreciation. To everyone who is struggling, you are not alone. You have not been forgotten, and we are here for you. We will continue to listen, continue to be flexible, and continue to innovate wherever we can. And we will find continued ways to continue helping Bermudians during this difficult period. Throughout our history, Bermudians have adapted to the circumstances and challenges of the day, and through hard work, sacrifice, and a willingness to do things in a new way, we have done more than just survive. We have thrived. Imagine if Bermudians of 100 years ago had just laid down when the tobacco growing industry, shipbuilding industry, and onion agricultural business could no longer sustain us. Imagine if Bermudians of old had never been willing to pursue tourism or welcome international business to our shores. Where would we be without our historic and cultural willingness to recognize the times, know the times, and change with the times? It has been said that Bermudians do not like change and can be slow to change. However, history shows that when the chips are down, we are and have had to be one of the most adaptable and resilient people in the world. This pandemic is a challenge, creating circumstances that none of us could have foreseen or could have prevented. It will take sacrifice, and it will take a community-wide willingness to adapt and change. It will take unity of vision, unity of purpose, and unity of a spirit to emerge from this stronger, but I am confident that we will. Finally, before questions, I have a special announcement. Today, I am honored to wish Miss Phyllis Wade a very happy and special 100th birthday with love from her entire family and everyone in Bermuda. I have known Miss Phyllis Wade for most of my life. She is a bright spark, and even at the age of 100, she continues to be a bright spark. Miss Wade, enjoy your 100th 420. Though your family may not have been able to throw that big party, everyone in Bermuda knows that you're inviting them to. We all now know your age, and we are now wishing you the best happy 100th birthday possible. With that, I'm happy to take any questions that the members of the media may have.
Good evening. Health Minister, you were talking about some of the additional measures you have recommended for additional measures.
As I said in the statement, from the moment that the outbreak took place, we took steps to immediately appoint an interim administrator to help to deal with the residents' concerns as well as the issues as it related to staff issues. A registered nurse has also been attending the facility since early last week. The Department of Health has also provided a registered nurse. We've had on Saturday, a medical director has been appointed to the home. So this particular doctor has been on site and has evaluated and examined the residents. The Department of Health is continuing to provide resource aids to the facility. PPE, a full supply of PPE has been provided to the facility. They've been provided with training, extra training from epidemiology and surveillance team to explain to them how properly to wear the PPE, how properly to dispose of the PPE, quality control measures as it relates to disinfection and cleaning and so forth. So quite a lot of extensive information has been provided to this care home, as well as the other 21 that come within the remit, the 21 homes actually that are part of our rest home facilities here in Bermuda.
Thank you. Mr. Premier, yesterday in your press release, you stated the 2 labs can run, when fully staffed, 900 tests a day. How many people are needed to fully staff the labs, and how many are available now, and what is the holdup with regard to fully staffing the labs?
I would say the holdup for fully staffed labs is just getting more persons trained and on board. I think that, however, I don't want us to focus on the number. 900 is the throughput, but you don't have to test 900 people if you don't have the need to test 900 people. So I think from the perspective of the lab of at Southside, which the Bermuda government MDL, that lab itself did about 200, I think you said 209 samples were collected. So there was 209 samples that were done in a day, and that's just in one particular lab. So in addition to the ones that we received from Helix today, which is about another 42. So in total, I mean, we've assessed 250 tests just today. The fact is that they will be staffed up. Dr. Weldon is in quarantine, should be released tomorrow. So that will add additional capacity, and I'm certain that we'll be able to continue increasing that.
Are there any thoughts to drive-in testing? Why or why not?
We actually do drive-through testing right now, and the Ministry of Health collection stations, when they do, it's appointment-based, and there is drive-through testing which is taking place. I think what you're talking about is that is part of the plans of which we've received, and I'm sure that we'll be implementing that shortly. As the Minister of Health has said, they're looking to do testing of essential healthcare workers and other persons. And so I think that will be done in the same way that is being done now, but probably on a wider scale with more than one collection station happening at a time. But that's for the Ministry of Health to go ahead and design. But our job is to make sure that we have the most aggressive test regime possible. And with the second lab coming on place, I think this will help to assist us in that aim.
Thank you. Minister Fogel, you mentioned there are 4,108 people who haven't received any checks yet. What percentage of those, or roughly how many of those, haven't been processed yet compared to the ones that are having problems? And of the ones that are having problems, what's the most common problem?
I think the most common problem was, as stated in my brief, is that persons who have filled out the applications have not either provided the requisite documentation to attach to the application, or they have made minor clerical errors, which has resulted in perhaps them not being able to receive monies because they may have put a digit in the wrong place when it comes to their bank account. And we are aggressively reaching out to those persons to let them know if those issues pertain to them, that those are the issues. And in other cases, sometimes employers who have received their employees' application through the electronic medium have not gone ahead and provided the necessary information so that that person's application can be processed to completion and indeed then be in line for receiving monies to their bank account.
And the first part of my question, how many of the 4,108 haven't been
I
processed?
don't want to give an exact figure because some of the applications are in various stages of the process. So it would be, I would perhaps be giving a misleading number if I try to give you an exact number.
All right, thank you. Health Minister, regarding the cases under investigation, in the last 10 days, it appears as we haven't been able to identify 10 or 12 of the new cases. If this continues, will it be likely that the shelter in place will be further extended? And how close are we to solving these cases? And how likely do we have asymptomatic spreaders out there that can't be accounted for?
Okay, that was actually 3 questions. So let me try answering them in the back from the most recent one moving forward. With respect to asymptomatic spreaders, you would have heard that what the government's steps that we are doing to be proactive with respect to addressing this COVID-19 crisis involves a number of things. One is the shelter in place. Clearly, by the extension of the shelter in place, that will help to limit the potential spread by persons that are adhering to that particular order, which is why you constantly hear us repeat ourselves of the importance of adhering to the shelter in place. You would also have heard the Premier mention, as well as myself, the importance of testing. And he elaborated on a few moments ago about the advances that we've made as a country with respect to ensuring that we have the capability to test more persons. And thirdly, you would have also heard me speak about the mitigants that we say that all of us can do, in addition to sheltering in place, that we can do to help to mitigate against the spread of COVID for persons that are asymptomatic or symptomatic, such as proper hand hygiene, sneezing and coughing in your sleeve, making sure that we adhere to our 6 feet social distancing requirements. So all of those things collectively are assisting us with respect to mitigating against the spread of COVID. Insofar as the first 2 questions that you spoke about, insofar as the contact tracing, you fortunately were able to have been present last week when Dr. Pete Ball spoke quite detailed about contact tracing and the steps. It's almost like an investigation. And in fact, we've spoken about it quite a lot of times about how detailed that contact tracing takes place. It is not something that can be done overnight, unfortunately. The advantage to this second tier of sheltering in place, it allows us to be it's easier to ascertain the contact tracing because persons, if they're adhering to sheltering in place, would be able to clearly identify who they've been in contact with because those persons are in their home.
Thank you.
Good evening. How are you? First of all, I want to state the story that I posted yesterday in reference to Matilda Smith is I stand by my story. And Minister, I want to ask you who you haven't named who exactly is in charge running the facility. Why is that?
I'm going to yield to my team. I think her surname is Barnett, but can you just, one of you say the name of the interim administrator? You might need to come to the mic. Oh, Ross Barnett. You can come to the mic. Oh.
Her name is Charmaine Ross Barnett.
Okay, Ms. Barnett. You stated an interim. This is the interim individual you speak of?
Correct.
My next question would be, if government is somewhat of the watchdog or regulators of these facilities, why did your ministry step in yesterday instead of the church that's supposed to be handling the affairs of this facility?
That's a very good question, Trevor. As you've indicated, rightly so, the Matilda Smith does have a board of trustees that you referred to. However, in addition to that, the government's mandate as it relates to all 21 homes is to ensure that we have proper provisions with respect to safety for our vulnerable persons that reside in those homes, as well as the staff members as well. So whatever resources that can be relied upon by the government, it is our obligation to ensure that those resources are made available, such as proper training, such as the delivery of PPE and the like to our 21 seniors' homes. The fact that they do have a board of governors obviously is a factor that, you know, if you had any questions, you could speak to them directly. But as the government, we do have an obligation to ensure that the 21 rest homes and senior homes that house our most vulnerable population have the needs and their needs are being met. And whatever way we can do that as a government, we will have to do.
I suggest your involvement with this as a minister and as a member of the Allen Temple AME Church. Wouldn't you consider that to be a conflict?
Absolutely not. I think there's probably, I don't know, I think there's probably at least 4,000 people that are members of the AME Church here in Bermuda. The fact that I happen to be a member of AME Church has absolutely nothing to do with the fact that I'm also the Minister of Health. As I've said, we have a responsibility as a government to ensure that all 21 of our homes have whatever services are required, whatever facilities that we can provide as the government to ensure that our most vulnerable in those 21 homes are effectively taken care of.
We have family members that are providing, and as of yesterday, have been providing vitamins, water, plastic utilities, etc., for their grandparents. They've called the ministry over and over out of frustration, and they have not been able to get a hold of the ministry to provide comfort for these patients that are at the facility. One. And two, how are they being looked after in this pandemic that they're dealing with down there?
Okay, I can answer that in twofold. One, actually, was part of the statement is that, as I've indicated, a medical director has been appointed to the facility by the Ministry of Health to provide on-site and off-site medical guidance. They have actually evaluated and examined a number of the patients. They're continuing to go through that process. There has been a nurse that's also been appointed from last week to assist with respect to the needs of the facility. In addition to that, the fact that you're saying that some family members may feel frustration, and I would invite them to reach out to me directly. However, as you did rightly say, there is a board of trustees that are effectively the care operators of the facility. So no doubt those family members would have also reached out, I would trust, to the board of trustees in addition.
Thank you, Minister. I don't know who this question could be posed to, but how many people in essential service? What is the numbers of those that are in essential service? And I've been told that testing is going to be for essential service workers, hospital workers. How many numbers are we talking?
I can't tell you the number of persons that are currently in essential services, and I can't necessarily speak to the amount of persons that will be tested. What I can speak to is the fact that we have committed to an aggressive testing regime. As release was put out yesterday, says that we have the capacity to do a number of tests that we can take care of, and it will factor onto the recommendations of which were coming from the Ministry of Health. But I would assume that certainly the first line of defense is healthcare workers, who are the ones that are essential, the ones who are most likely to be exposed, and then you will go to persons who are on the front line, such as police and the regiments, and also persons who may be in grocery stores or frontline serving where they're in contact with a lot of persons. I think those are things which are particularly important. But we will be guided by the science and guided by the advice of the Chief Medical Officer as we look to expand this very aggressive testing policy that we have.
Thank you very much. Good evening, Mr. Premier, ministers.
Can you speak up, please?
I can. Mr. Premier, my first question, in the statement that came out yesterday regarding the second testing facility coming online, you said that throughout the day, 190 samples were taken from individuals who were in 6 government quarantine facilities, pardon me. I think you've revised that number to
209.
209. The statement went on to say the MDL, which is the second lab that just came online, will complete the tests and supply the results to the Ministry of Health this evening. My question is, if those tests were conducted yesterday and the results were received yesterday evening, in the past we've heard of a turnaround period of between 24 hours and 48 hours for test results. Has this been sped up? Is this process now quicker?
I can say that in order, and I know a little bit more about this, and I know that we've offered to have persons sit down with the Gazette to run through the entire process. But let me help out. Once someone gets swabbed, there's a few processes after that. But technically, if there's nothing else that's happening, if there's nothing else to be done, and you have enough, that's perfect. You can technically complete the process from beginning to end in about 4 hours. So that's how long it takes. Now, the fact is that there's reporting that goes into place, and we talk about when it comes to reporting results. So a perfect example is the minister had indicated in her statement that preliminary results had been received by the Ministry of Health. But the thing is, I've actually gotten in trouble, and the government's gotten in trouble or difficulty, because we've come here and we've said there's a number of persons who are positive, a number of persons who are negative. We announced positive where we haven't actually told the persons, whether or not they've tested positive or negative, and they haven't been informed. So persons who may have been tested then hear that we have positive results, and that causes everyone to be nervous as to whether or not they're positive, whether or not 4 to 48 hours. It's the difference between the time that the testing happens, the time until when we report it to the public. But there are doctors who are getting things very quickly. Sometimes the hospital requests things on a more quick basis. So once the lab gets the test, it takes about 4 to 5 hours in order to process those results.
I appreciate that clarification. My second question, whether more appropriate for you, Mr. Premier, or Ms. Wilson, both of you have spoken in the past, I believe within the last week, about modeling from Bermuda. I believe we've talked about this past weekend and even today as far as when that information would be publicly available. When can the public expect modeling information for Bermuda?
Thank you for that. I was anticipating that we'd be in a position to actually be able to produce that today. However, it hasn't been completed and finalized, and I think you would agree with me that we would want something that's more perfected as opposed to trying to rush to an artificial timeline. But what I can assure you, as well as the other members of the press, is that as soon as that is made available and it's completed, then you will be the first to receive it. So I would anticipate certainly within the next couple of days. It will certainly be information that will be very valuable and certainly well worth the wait. But I'd rather make sure that it is close to as perfected as possible as opposed to trying to rush to arbitrary timelines to produce it.
Follow up then on that. What is the delay the result of?
The data, it's not really a delay as a result of anything. We're getting, like I said, the data is being collected locally, but the model itself is from Public Health England as well as Imperial College of London. And there's been certain questions that have been asked by the Premier, such as a calculation. If you do this, what does that look like to, like if you enhance the mitigations, what does that look like to the figures with respect to the curve? So we're looking at trying to get that information from Public Health England so that we can model it effectively. So if circumstances change, we can model it to see what does that do to our time frame moving forward. And I suspect when I've given you a copy of it, you'll understand what I mean. But if you change variables, we want to know if we change those variables, what does it do to the timeline going forward? So that's what we're working on.
I appreciate that,
Mhm.
Minister. Minister Keynes, a question for you, if I may, sir. Last night, government confirmed that the e-application form for businesses who wish to operate was online and ready to go. You provided an update today on how many, I guess, applications had been submitted and how many had been green lit. I'm wondering, will a list be provided online so that members of the general public can go somewhere and take a look at what businesses they might be?
Forms a part of our plan. As you can imagine, over the last few days of getting the legislation ready, making sure that it was indeed fit for purpose. Today, the vetting process has been a Herculean task, and the team have been up to it. And so, what we want to do is make sure that we have all of the component parts right, to make sure that we are getting the approvals out. And when that is completed, obviously it has not been completed, we will get a list and make that list available for the general public.
Thank you. To whoever is best placed for this one, I'm wondering what measures are in place to prevent spread of the COVID-19 virus at the government's emergency housing facilities like Gulfstream in St. David's?
I'm happy to take that question. I can't speak specifically to what's taking place at Gulfstream and St. David's, but what I can speak to is that the Ministry of Health has been coordinating and working with all various government departments on making sure that in all instances, in all places, the proper and necessary precautions are taken. If there's any information we have to the contrary, I'd love to receive and have that, but I'm certain that we can, if there's a direct query, can give you an answer to that. But I know that that falls under the responsibility of the Minister of Public Works, and I don't think there's any minister here that can actually answer that.
Appreciate that. My final question, a reader question. This comes from an individual who uses the online handle Warwick Boy. This person asked, the government has been cajoling landlords to forgive rent demands if at all possible. Will the government waive land tax for the 2020 year to enable more landlords to do that?
I'm quite certain that the government will not waive land tax for the entire year, but I recognize the question and the intent of the question of which the person is asking. And I think that as part of the package that the Minister of Finance is putting together, if we are making those things, there might be some level of forgiveness which may want to be considered. But I would think that that would be very limited in any particular circumstance. It would only be for those persons who may have given such relief.
Thank you all.
Panel. Premier, I wonder if you could respond to the request that our readers have been sending in with regards to the fact that there's day-to-day information on the current status of cases and so forth, but a number of readers have called perhaps on you as the leader, if you can indicate without divulging cabinet discussions, which doesn't happen, but when you use terms like others that we're facing times likened to the Great Depression, considering the fact that Bermuda already has a multi-billion-dollar deficit, what's the economic plan looking like moving forward, considering the CDC, for instance, has extended the no-go for cruise ships, which takes us into August. Essentially, that's the bulk of the season. Can you speak to perhaps the outlook on that in terms of financial planning?
I think that the Minister of Finance covered most of those things on Wednesday, and I'm not going to necessarily preempt anything further which he has to say. But as I've said at this podium and from the Cabinet Office, that the economic circumstance is going to be particularly challenging. And that's the reason why the government has been focused so intensely on making sure that we can increase our testing capacity, because the increasing of the testing capacity is what's necessary in order to get us to the place where we can reopen our economy. Now, the advances in the management of this disease are changing very quickly. It is unknown as to whether or not when it may come a point in time that the airport may reopen to tourists, whether or not we'll be able to have rapid testing capability, et cetera. Those are things that cabinet ministers are working on and various bodies are working on. But our desire is to get the economy open and functioning as quickly as possible. So just to feed into a question that Don had asked, to the Minister of Health when he said, because of these undetermined cases, is there an expectation that the shelter in place will be extended? The answer is no. We are going to be coming out to shelter in place on the 2nd, and we have the testing capacity and also with the additional IT tools which are coming online to aggressively test and isolate persons who may be carriers of the virus. And that is the best way in order to defeat this virus. And so from that perspective, this shorter term shock of which we have, the easier the economic recovery will be. But on the basis of your question, tourism is a particular challenge. The cruise ship season is going to be a particular challenge, and we're going to have to get through this particular year, but it is not going to be easy under any circumstance.
I think it's fair to say that some jobs will not re-emerge like we knew them. For instance, some restaurants may just switch to takeout. Do you anticipate further job losses?
I think that we've had a significant amount of job losses now, but I would classify a lot of those job losses as temporary job losses. But the thing is that we can look to examples of other countries who have managed to reopen, who have been very aggressive at the early outset, and have aggressive testing systems in place. So I think from the perspective of will we recover as much as we were to where we were before very quickly? I don't believe so, but I do know that the Minister of Finance is determined to make sure that we put the economic stimulus in place to get our economy back in functioning as quickly as possible.
Well, hypothetical as it stands now, the unemployment benefit that went into effect March 25th, it is for 12 weeks, which means it'll expire for those people who are getting it on June 25th. Do you anticipate having maybe to consider extending it if people are, say, out of work until September?
What I would say is that we will look at the circumstances, and I think that the history of the government in managing this crisis is that we will be flexible and to adjust to what the circumstances dictate. And to remember that there was no actual legislated unemployment insurance that existed in Bermuda. And so we created this program in a matter of weeks to make sure that we could get relief to persons as we knew there would be challenges. So we're going to be flexible as the situation demands, but our main goal is to get the economy open as quickly as possible. We're not going to do it by being unsafe, but we are going to make sure that we take advantage of our testing capacity, which we have, to make sure that we do what is necessary to control this virus, and that is to test and to isolate persons who may be carriers of this virus.
Now, the unemployment benefit, it does benefit people who qualify, but you would also know that Bermuda is a hustle community. Some people are just making it from one job to the other who do not pay payroll tax. Caregivers who work for government, for instance, are out of work because their jobs have been canceled. Children still have to eat. Can you say something that speaks to that single mother who's struggling right now with no employment or benefits?
Absolutely, I can. I've said that that is part of the reason why I have said it when I'm at this podium. And I repeat to the efforts of the third sector, I even said it today, that persons who are in those situations do not suffer in silence. There is assistance that is necessary. People have written to me. We've made sure they've got groceries. I would say that in this circumstance, the third sector has been incredibly helpful. And the efforts of Ms. Myra Virgil with the Bermuda Community Foundation and all of the third sector partners of which she's pulled together are making sure that people in our community are not going hungry. And that is something I think is testament to the fact that Bermuda is working together to ensure people can survive through this crisis. But that's why it is critically important to get the economy working as quickly as possible again. But the only way we're going to do that, Ciola, and this is something that's very important for your readers and everyone who's watching and listening, is people must observe these next 2 weeks of shelter in place. People are upset that I'm telling people that they're still going to stay off the beaches and out of the parks, etc. We have to sacrifice so that we can get this done quickly, that we can put in place the controls, and that we can get the economy back open.
Idea on numbers of people desperate for groceries or food or assistance? Is it hundreds? Is it thousands? Or is it just a few?
I don't know, to be completely honest. I don't have those statistics, which would come from the helpline. I think that I might be able to gather those statistics. But what I do know is that everyone who has a challenge, their needs are being met. And I think that's the most important thing. We want to make sure those persons' needs are met, and that's what's necessary for a responsible society.
Last question, and this might be for you, Minister Keynes. When you rolled out the new additions, people were under the impression that they could get to the laundromat today. And the other question is, does it make sense to have laundromats by appointments and one or two washers and dryers going at a time, then perhaps people could leave the laundry and have have staff do the laundry and pick up and pay a fee. That's the question. And it's mainly by people like garbage men who are out collecting the public garbage, who don't have the luxury of being able to wash their work clothes at home.
This has always been something that has been a work in progress. As you can imagine, on the first iteration of these regulations, we did not include laundromats at all. We listened to what the public has said. We took advice from how to deal with this and make this safe. If you look at the regulations, Section 3, only customers who are members of the same household shall be allowed at the laundromat at one time and by appointment only. Section B says, wash and fold services may be provided as long as the customers are not permitted to enter the premises during the drop-off or the collection of their laundry. And so we're giving directions, and so people could fill out the directions. We give them care guidelines on how they should do it. People can go onto BermudaLaws.com, or they can look at the legislation. It actually sets it out line by line, precept upon precept, how people are able to get their clothes washed. Remember, this process is to make sure that we stay safe. We actually understand that there are segments of our community that need support. They need the laundromats, and this legislation is as wide as possible, being as safe as possible, to make sure people are able to take care of their fundamental needs, which is washing their clothes.
As to when they'll open?
I would say that the Ministry of National Security, and just to make sure I clarify that last question, has been very flexible on this. As the minister said, that there are not only one person per household that's allowed, not one person, but one family that's allowed in laundromats, but also known. I know that there's a few persons that are asking whether or not the government will publish the businesses which are open, and I think the Minister of National Security said that he will endeavor to do that. It is being done through an electronic process, so it should be pretty easy to go ahead and get that complete. One of the benefits of this entire process is that we've had to transition the government to a paperless government rather quickly, but we were able to take advantage of a lot of things that had been under development for the last few years, and that's the reason why we've been able to put up so many online forms, which are allowing citizens to interact with their government very quickly during this period in time. So I want to thank everyone for their particular time and attention. I want to thank the ministers and also Dr. Daniels for her particular information. There will be possibly some additional results which are going to be released later this evening. I know that there are some persons in the government quarantine facilities that are worried about the notes of which they've received, saying that their stays are going to be extended. We have received preliminary results from the lab at Southside, the molecular diagnostics lab, and we will be making sure that we communicate to those persons so that they can return home tomorrow if they do have negative results. Our next press conference will be, yes, from 2 o'clock. So not at 8:30 in the morning, as was originally scheduled, but we will start releasing persons in the afternoon once all the results are confirmed. I hope that everyone will be patient with us and recognize that the challenge of which we've had before, when we've listed positive and negative numbers without being able to inform persons beforehand, it makes every single person nervous. And the last thing I want is for 209 persons to be nervous this evening. We will contact the persons, we'll make sure everyone is known, and then persons will be able to go back to their homes tomorrow. So with that, I hope that everyone has a good night, and Ms. Phyllis Wade, happy 100th birthday.